Good morning, everyone. We are Group 3 and we will talk about diarrhea, dysenteria, and beri-beri. So here we have the reporters, Faith Go for background of each cause of death and results and findings.
And Marian Abusia will be reporting the contextualization conclusion.
To start off, we have diarrhea. Diarrhea is a loose, watery stool. And you have diarrhea if you have loose stools 3 or more times in one day. In most cases, the cause is unknown and it goes away on its own after a few days. Diarrhea is usually a symptom of an infection in the intestinal tract, which can be caused by a variety of bacterial, viral, and parasitic organisms. Infection is spread through contaminated food or drinking water, or from person to person as a result of poor hygiene. There are actually several different ways to classify diarrhea. These types of diarrhea include acute diarrhea, which is the most common and lasts 1 to 2 days, and this type doesn't need treatment, and it usually goes away after a few days. Second, we have persistent diarrhea, which persists usually for 2 to 4 weeks, and chronic diarrhea, which lasts for more than 4 weeks or comes and goes regularly over a long period of time. The cause of most self-limited diarrhea is generally not identified. The most common cause of diarrhea is a virus that infects your bowel. The infection usually lasts a couple of days and is sometimes called intestinal flu. Other possible causes of diarrhea can include infection by bacteria, infections by other organisms and preformed toxins, eating foods that upset the digestive system, allergies and intolerances to certain foods, medications, radiation therapy, and malabsorption of food. The symptoms you can experience when you have diarrhea can vary depending on if it's mild or severe and what the cause of the diarrhea happens to be. When you have diarrhea, you may experience all of these symptoms or only a few. Symptoms of mild diarrhea can include bloating or cramps in the abdomen, a strong and urgent need to have a bowel movement, and nausea. And if you have severe diarrhea, you may experience symptoms like fever, weight loss, dehydration, severe pain, vomiting, and blood. In most cases, you can treat mild and uncomplicated diarrhea at home. When diarrhea lasts for a long period of time, your healthcare provider will base your treatment on the cause. This could involve a few different treatment options, including antibiotics, medication for a specific condition, and probiotics. So for antibiotics, healthcare providers might prescribe an antibiotic or other medication to treat an infection or a parasite that's causing the diarrhea. Medication for a specific condition. Diarrhea can be a sign of several other medical conditions, including irritable bowel syndrome, IBD, such as Crohn's disease and ulcerative colitis, and microscopic colitis or bacterial overgrowth. Once the cause of the diarrhea is identified, diarrhea can usually be controlled. And lastly, probiotics. Groupings of good diarrhea. Probiotics are sometimes used to reestablish a healthy biome to combat diarrhea. Here we have history. Hippocrates is universally credited for coining the term diarrhea. Derived from the Greek word diarrhea, which means flowing through, the term is found in numerous places in the Hippocratic corpus, as it is a symptom of a variety of diseases, including its relationship with poor food handling, intestinal parasites, jaundice, dysentery, and cholera. In the Philippines, diarrheal disease is the second leading cause of morbidity and sixth leading cause of mortality for all ages. It is the third leading cause of infant deaths. The surveys done in La Union, Bohol, and Bukidnon in 1985 showed that every Filipino child suffered an average of 2.8 episodes annually. In 2016, diarrhea was the sixth leading cause of disease in Metro Manila and among the top 10 causes of disease nationally. Here we have the cure. Immunization against the pathogens that cause diarrheal disease is a viable prevention strategy. However, it does require targeting certain pathogens for vaccination. In the case of rotavirus, which is responsible for around 6% of diarrheal episodes and 20% of diarrheal disease deaths in the children of developing countries, the use of rotavirus vaccine in trials in 1985 yielded a slight decrease in total diarrheal disease incidence, while reducing overall mortality by 6 to 10%. Monovalent RV vaccine, or the RVV, was selectively introduced in 2012 in the Philippines and in July 2014 was introduced in the public health program of a province. 2 RVV doses are recommended at 6 and 10 weeks of age. RVV was first introduced in the Philippines National Immunization Program in 2012, targeting children who belong to the poorest quintile. The World Health Organization has recommended RV vaccines used in national immunization programs since 2009. However, access to vaccines remains limited, particularly for most low and middle income countries where the burden of the disease is high. The Philippines is a lower middle income country in Asia where RV vaccination remains limited. And recent studies in the Philippines indicate an estimated vaccine effectiveness of 60% against RV hospitalization and a 50 to 60% reduction of all-cause diarrhea among children aged under 5 within the population. New vaccines against rotavirus, Shigella, ETEC, and cholera are currently under development, as well as other causes of infectious diarrhea. Here we have dysenteria. Dysentery or dysenteria is an intestinal infection that can cause severe diarrhea that can last for 3 to 7 days. In some cases, dysentery can produce mucus in stool and some blood. It is usually infectious that can be passed on if you do not take the right precautions. It is usually spread because of poor sanitation and hygiene. And in this kind of infection, the intestines have parasites, and the parasites are called amoeba. This inflammation is usually found in the colon that can be fatal if neglected. Some symptoms of dysentery are abdominal cramps, nausea, flatulence, vomiting, and fever. And there are two types of dysenteria. These are Baccilliary dysentery or shigellosis, and it is an infection caused by the Shigella bacteria and is the most common type of dysentery. And we have amoebic dysentery. It's an infection caused by a single parasite in the intestines that is also known as amoebiasis. It is less in developed countries and usually found in tropical countries with poor sanitation. The most common cause of dysentery is by drinking water and eating food that is contaminated with Shigella, E. coli, and amoebobacteria from feces with pathogens. These organisms are present in stools from people and animals, and people with weak immune systems are the most susceptible to develop dysentery. The most common cause of dysentery include certain types of E. coli, Salmonella, and Shigella. Signs and symptoms for dysentery can last for several days, 4 to 7, and even more. The symptoms can vary among individuals, and some only suffer from mild symptoms, and there are some that actually get severe dysentery. And some signs of severe dysentery include diarrhea and vomiting. Fortunately, this disease can be treated through antibiotics. History. The bacteria causing dysentery is called Shigella dysenteriae. It originated in Europe and was spread to the rest of the countries decades ago by immigrants and colonizers that migrated into another country. It is reported to have killed a substantial amount of people in the 1700s to 1800s. So for cure and treatment, we have the Baccilliary dysentery treatment. This kind of dysentery does not need prescription, and since most of the time the disease passes on its own after a week. These are the few things you have to do while you wait for it to be over. First is to drink a lot of water and other sports water to bring back the fluid that you lost. You can also take paracetamol to ease the pain. Second, we have amoebic dysentery treatment, and the person that has this disease can take antibiotics to kill the parasites in the blood, intestines, and liver, and the medication can stay for 10 days. Third, we have Beri-Beri. Beri-Beri is a severe and chronic form of the disease that causes inflammation of the nerves and heart failure. It may be life-threatening if it can't be treated due to the risk of heart failure or worsening the nervous system. However, it is also similar to thiamine deficiency that is caused by deficiency of vitamin B1 that is a medical condition of low levels of thiamine. They may be found or identified in the women who have experienced vomiting in pregnancy and extreme nausea. So there are two types of Beri-Beri. We have wet Beri-Beri and dry Beri-Beri. Wet Beri-Beri may cause heart failure and can be treated in a daily treatment with 100 to 200 milligrams of thiamine that makes use of the dose to increase based on the life-threatening conditions. And dry Beri-Beri, which could damage the nerves and lead to decreased muscle strength, which also may lead you to have muscle paralysis and can also be treated with the same treatment of thiamine supplement in daily treatment. The cause of Beri-Beri is having a low diet thiamine. There are possible risks that may cause Beri-Beri, which includes alcohol use, genetic Beri-Beri, hyperthyroidism, extreme nausea and vomiting in pregnancy, bariatric surgery, AIDS, prolonged diarrhea or use of diuretics, and undergoing kidney analysis. The symptoms of Beri-Beri depends on the type of situation that you're currently in. So these symptoms include for wet Beri-Beri is rapid heart rate, shortness of breath during physical activities, swollen lower legs, waking up short of breath. And for dry Beri-Beri, we have difficulty speaking, pain, paralysis, decreased muscle function, particularly in the lower legs, vomiting, and mental confusion. So history. Beri-Beri was known for millennia in Asia, but was not described by European until the 17th century, when Brontius in the Dutch East Indies reported the progressive sensory-motor polyneuropathy. The prevalence of Beri-Beri increased greatly in Asia with the change in the milling process for rice in the late 19th century. In the 1880s, Takaki demonstrated the benefits of dietary modification in sailors, and later instituted dietary reforms in the Japanese Navy, which largely eradicated Beri-Beri from the Japanese Navy by 1887. In 1889, Ijkeman in Java serendipitously identified dietary factors as a major contributor to chicken polyneuritis, which he took to be an animal model for Beri-Beri. The polyneuritis could be cured or prevented by feeding the chickens either unpolished rice or rice polishings. In the Philippines, a proposal was made to enforce the use of brown rice by the local military. This, of course, is rice from which the husk has been removed, but not the entire bran layer and germ. This was the traditional staple of villagers in Southeast Asia who had no access to mechanical rice mills. They would pound their paddy in some kind of bowl and then winnow the product so that the lighter husks blew away and the greens fell in a pile. It was repeatedly found that in the tropics, brown rice on storage would become infected with insects of different kinds, and the oil in the bruised germ would become rancid. The early workers who discovered the association of Beri-Beri with white rice had assumed that the important micronutrient was concentrated in the bran of the grain. However, it was later realized that more was present in the germ area. Japanese millers then attempted to modify their machinery so as to remove the bran without removing the germ from the grain. The so-called germ rice that they were able to produce proved to be both palatable and an improved source of thiamine. In the Philippines, Beri-Beri disease is the leading cause of death, according to American researchers, which have been stated in numerous reports between 1920s and 1930s, with about 12,000 and 20,000 cases a year. Cure. The basic treatment for Beri-Beri is to bring thiamine levels in the body back to within normal range. This is accomplished through the administration of oral or injectable thiamine supplements. Additional vitamin supplements may also be recommended. If Beri-Beri is treated promptly, most symptoms of the disease will be reversed. Thiamine is found in a variety of whole foods such as fortified breakfast cereals, macadamia nuts, pork, beans, and lentils. So here we have the results and findings. Out of the 732 entries in the burial registers, 22% or 161 entries of the total entries had diarrhea, dysentery, and Beri-Beri as their cause of death, while the other 78% or the 571 entries had other causes of death such as ahogado, alpharesia, Ruella, Simpacho, Malparto, TCs, and Pasmo, amongst others. This means that at least 1/4 of the total cause of death of the burial registers are associated with diarrhea, dysentery, and Beri-Beri. And specifically on diarrhea, dysentery, and Beri-Beri, out of the 161 entries, majority of the cause of death is diarrhea at 87%, or it makes up 140 entries, while dysentery and Beri-Beri are at 8.1% and 5% respectively. This would mean that diarrhea plays a major factor in this particular area of cause of death. So based on the graph, the majority of the people who died due to diarrhea, dysentery, and Beri-Beri were from the ages ranging 16 to 30 years old, and 50 entries of the 161 entries were 16 to 30 years old. 36 entries were 46 to 60 years old, and 20.5% were 31 to 45 years old. 28 entries for 0 to 15 years old, and 14 entries for 61 plus years old. Based on the pie graph, we could see that the majority of the deaths are found in the ages of 16 to 30 years old. This means that almost 2/3 of the entire entries were 16 to 30 years old, and only 1 out of 11 of the entries were 61 years old plus. So status. Based on the graphs above, the majority of the people who died due to diarrhea, dysentery, and Beri-Beri were India. 68 entries of the 161 entries were Indio, 52 entries were India, 22 entries were Mestizo de Sangli, and 19 entries were Mestiza de Sangli. Based on the pie graph, we could see that 74.5% of the people were Indio or India. This means that almost three-fourths of the entire entries were Indio or India, and only one-fourth of the entries were mestizo or mestiza de sangre. Year. Based on the graph, almost all of the burial registers were from the year 1889 with 727 out of 732 entries. There were three entries from the year 1888, while there were two entries from 1890. This would mean that the burial register started from the end of the year 1888 and ended at the very start of the year 1890. Gender. Based on the graphs above, the majority of the 161 entries who have died due to diarrhea, dysenteria, and beri-beri were male, with 55.3%. For diarrhea, 77 entries were male, while 63 entries were female. For dysenteria, 9 entries were male, while 4 entries were female. For beri-beri, 3 entries were male, while 5 entries were female. In total, there were 89 male entries while there were 72 female entries. This would mean that there were more males than females who died because of diarrhea, dysentery, and beri-beri. To sum up all of the results, we can assume that diarrhea plays a major role in the morbidity rate during late 1888 to early 1890 in the Philippines. We can also assume that most of these people were primarily Indios and Indias who were aged at 16 to 30 years old. There are also more male entries than female, with a 10.6% difference. Based on the causes of the certain cause of death, we can say that the Indios and Indias were most likely to be living in poor and unhygienic conditions to be able to contact infections that would lead to diarrhea.
What is the condition of the Philippines during that time? The burial registers contained information that helped us learn about the social differentiation in the past. In fact, the political status of the people from the burial register entries were either India or India and Mestizo de Sangli or Mestiza de Sangli. The India or India are the Malayan native-born inhabitants of the Philippines, while the Mestizo de Sangli or Mestiza de Sangli are the offspring of Chinese and Indios or Mestizos. According to Chu, the rise of the Chinese mestizo class, also known as the mestizo or mestiza de Sanglis, in the Philippines can be traced to the middle of the 18th century. The unions between Chinese and local women grew in number because they were encouraged by the Spanish colonial policy. With that, Chinese mestizo children grew in number as well. Because of the increase of Chinese mestizos, especially in urban areas, the Spanish colonial government decided to establish a separate legal classification for them. The population of the mestizo or mestiza de Sangli indeed grew to a significant number during that time because, based on the burial registers alone, they already comprised one-fourth of the entries. Initially, they established a legal classification for the mestizo or mestiza de Sanglis for the purpose of taxation. Following its policy of taxing their subjects according to their capacity to earn, the Spanish colonial government taxed the Chinese the most, followed by the Chinese mestizos and then the Indios. However, however, this division later affected the right to travel, property ownership, and participation in government. According to Tan, the Chinese mestizos played an important role in the formation of the middle class, agitation for reforms, the 1898 revolution, and the formation of what is now known as the Filipino nationality. Based on the results and findings, the common cause of death was due to diarrhea. Majority of these burial registers were from the year 1889. From the status spy graph, 74.5% of the people were Indio or India, which means that almost three-fourths of the entire entries were Indios or Indias. As what was previously mentioned about taxation, the Chinese were taxed the most, followed by the Chinese mestizos and then the Indios. Since they were taxed according to their capacity to earn, we were able to assume that most of the Chinese are from the upper class. The Chinese mestizos are from the middle class, and the Indios are from the lower class. According to Jameson and others, there exists a strong relationship between poverty, an unhygienic environment, and the number and severity of diarrheal episodes. Therefore, the Indios during that time could have experienced poor housing, dirty floors, lack of access to sufficient clean water, or to sanitary disposal of fecal waste, cohabitation with domestic animals that may carry human pathogens, and many other factors which increase the frequency of diarrhea. This explains why a large portion of the Indios or Indias died due to diarrhea. Due to their poverty, they were probably exposed to an unhygienic environment and were not able to have access and afford medical care. According to Smith, who assessed the impact of major political and socioeconomic changes in the 19th century Philippines, the level of mortality increased as the 19th century progressed. He suggested in his paper, that the observed patterns of mortality result from the general decline in the level of living among the peasantry resulting from the 19th century commercialization of Philippine agriculture. According to Wickberg, Philippine lands began to be used for commercial agriculture in the latter part of the Spanish period. He also stated that the Chinese were commercially oriented moneymakers. The Chinese mestizo was possibly engaged in agriculture, possibly in commerce, and possibly in both. And the India's concern is chiefly agriculture. This provides evidence that because the Indians were involved in agricultural labor, they indeed struggled with the decline in the level of living among the peasantry resulting from the 19th century commercialization of Philippine agriculture. Their struggles during the commercialization of agriculture then affected their mortality. For the other evidences, based on the data that we have gathered on the burial registers, we can also assume that the advancement of medicine and technology for vaccines happened much later than the year stated in the burial registers. During the 17th and 18th centuries, the number of medical supplies pouring into the Philippines was dependent on the yearly Manila Acapulco galleon trade, wherein medical supplies come mainly from Mexico. Supplies had been routed from Europe to Mexico and then to the Philippines. In addition to this, the number of certified physicians, pharmacists, and surgeons trained in Europe were concentrated at the Cuerpo Sanidad Militar located in Manila. Despite the Central Board of Vaccination being established in 1806, there is no assurance and guarantee that these vaccines were would reach more rural places in the country. In addition to that, the monovalent RV vaccine, which helped decrease the morbidity rate of those who died of diarrheal diseases, was only introduced in the Philippines during the 21st century. Having limited certified physicians and medical doctors in cities and provinces other than the main Manila area would have caused misdiagnosis or even the lack of the proper diagnosis in areas such as where the burial registers were from. It tells us that those who were in higher societal status, such as the mestizo or mestiza de sangres, could have afforded the treatment of the disease and would have probably been more prioritized by doctors and physicians. Next, we have the significance of burial registers. Burial registers are significant because they contain information that help us understand the social, political, and economic condition of a certain time period. Through listing down details such as gender, age, status, cause of death, and year of death, we were able to create graphs or charts. The results that we got allowed us to interpret the data, look for patterns or relationships between the data, and analyze what the results say about the social, political, and economic condition in the past. So, for social, from the status alone, we were able to find out about their social differentiation. Accompanied by further research, we were able to learn more about how and why the status classification or hierarchy developed within the society. By analyzing the relationship between a person's gender, age, status, cause of death, and year of death, we were able to identify patterns. For example, if most of the Indias or Indias died due to diarrhea, we were able to identify and research their capacity to earn and relate it to another research which proves how poverty affected the people's likelihood of getting sick. For the political and economic side, looking into the chart created from the data on gender, age, political status, cause of death, and year of death, we were able to identify the relationship between them and how it relates to their political and economic situation. For the status, we were able to observe that India or Mestiza or Mestiza de Sangli were the two statuses stated in the burial registers. Researching about these allowed us to gather information on how unions between Chinese and local women were encouraged by Spanish policy. This made us understand how politics were part of the reasons as to how and why the mestizo or mestiza de sangre legal classification was established. Lastly, we were also able to research that there were political and socio-economic changes in the 19th century Philippines. We were able to relate our findings with what we have researched. Thus, we were able to identify that the political and economic changes led to the commercialization of agriculture, which affected the Indios or Indias the most. All of the information we have gathered from the burial registers aided us in finding the relationship between our results and findings with the information we have read and researched. With that, we were able to conclude and make assumptions about the social, political, and economic condition of that certain time period. For the next slides, we have our references. That would be all, and thank you for listening.